Okay, Suzanne, what we're going to do today is an occlusal analysis. And so I want to talk to you a little bit about what an occlusal analysis is and why we're doing that. Okay? I would guess that probably the majority of dentists don't do this procedure. Okay? But it's a very important thing to do to make sure that the long-term success of the treatment that we want to do is successful and it works for you. And we do this procedure a lot, every single time. If somebody having problems with their joints, you know, TMJ problems, clicking and popping and pain, and if they're having a lot of wear issues with their teeth and just different things that are related to their bite and their joints. And what we do is we go in there and I'll get a bite registration, I'll do a bunch of records, we'll get some impressions, we'll get some pictures, I'll do palpation of your muscles and see which muscles are sore and which muscles are causing you pain and problems, and just go through a lot of series of that. And then once I have all of that information, then I'll go in the lab with what we call an articulator, and I'll study your bite, and I'll see how your bite is working, how your teeth are coming together, and see exactly what we need to do to correct your issues and get you comfortable and the way that things need to be functioning so that you can function good and so that your teeth will look good. So we do this procedure, like I say, with people who are having issues with their joints and problems, and also any time that we're going to do a significant amount of work on somebody, whether it be implants or bridges or a lot of cosmetic work in the front where we do veneers or change their smile in any way, then we want to get this analysis to where we can make sure that we're putting things back where they need to be and it's going to be right and it's going to last a long time. Okay, any questions? Or we'll just go for it. And okay, Suzanne, the first thing I'm going to do here is I'm going to check your bite, okay? And I'm going to just see where your teeth are coming together, and we want to make sure that your joint is seated in the proper position, okay? The most stable, comfortable position that it needs to be. So go ahead and just kind of bend your neck back and open and just relax your jaw as much as you can. Okay. Are you having any tenderness or soreness in any of these areas where I'm touching?
No.
Go ahead and open and close a couple of times. Any tenderness or soreness there?
No.
Any soreness or tenderness down in here?
No.
In here? Any headaches or problems or anything like that?
No.
Okay. Let me check one more thing here. What I want you to do is open as wide as you can, and I'm just going to measure how far you can open. Okay, Suzanne, what I'm going to do here is we're going to test your joint for any sounds of crepitus and clicking and popping, and we're going to test it with this. It's a Doppler that you can hear, kind of like that they use to look at babies and things like that. This is what we're using here to test the joint. Okay, so this is just a registration to where we can see how your top teeth are sitting in your head, and this is another one of the little tools that we use to make sure that we're going to get everything just proper when we do the analysis that we're going to do. Okay. Okay. Rest your head back there. Sorry. Okay, Suzanne, this is going to be a little bit warm. I'm going to put this in there, and then I'm going to help you close down into that wax, okay? So Suzanne, this is not your teeth, but I'm just showing you just so that you can kind of see what we're going to be doing, okay? This is an articulator, and this is what I study your bite relationship in the lab. And so I can, from all of the records that I just did, I can mount that on here, and I can be able to see how all of your jaw moves, and all of those movements I've been able to capture in the records that we got. And so I can study it and determine the correct treatment plan to get your teeth coming together in the right way and your joints positioned in the right spot and get everything exactly how we need it. And if we're going to do any cosmetic work on your front teeth, we can figure all of that out, and I can wax those teeth up nice and pretty how we want them to be, and then you can look at those. So we'll have you come back in about a week or so, and we'll go over all of the results from this analysis appointment.